All right, so hello everyone. My name is Stephanie and welcome to my conference presentation. I'm excited to share my learning journey at Island Health. Firstly, I'd like to acknowledge and respect the Lekwungen peoples whose territory I've had the pleasure to learn, be a student, participate in my practicum journey, um, and the Lekwungen peoples whose historic relationships to this land to this day. And lastly, as a former student of Island Health, I'd like to acknowledge and respect the Coast Salish, Nuu-chah-nulth, and Kwakwaka'wakw people whose unceded traditional territories are used for healthcare, learning, and services. So first things first, I'd like to introduce kind of my placement. And so I was working with the Population Public Health Assessment team at Island Health. My practicum was remotely here in Victoria. And I was working under Public Health Supervisor Jacqueline Eckert. So here's a visual I actually made that encapsulates pieces that contributed to my practicum. I thought this would be kind of a unique way to explain how things tie together. So at a glance, you can see the kind of grayish triangle is my role at Island Health and is kind of the foundational aspect to the visual. The red, the blue, and the green circles are core skills that I expanded on during my 4-month practicum journey. So I have literature evaluation, which was kind of reviewing reports, creating reference lists, and providing feedback to enhance clarity and understanding. And then knowledge translation down in the left corner, which is I created a chronic disease introduction for the 2024 Island Health Population Status Report. And lastly, in the blue, data analysis, which took part in actually many forms of which I will show later in my presentation. And this encapsulated making 2 bar graphs. And then on the left side, these are things that also externally contributed to my practicum. So public health and social policy skills, such as cultural humanities and supporting advocacy through public health priorities. And some values, interprofessional research, respecting Indigenous self-determination as well. So mind you, these are just 2 of the many that contributed to my practicum. And then on the right, I have kind of my positionality and external work experience. So currently I work as an EA, and I've had previous work experience in the community support work and medical office assisting. And this kind of all contributed to my knowledge, perceptions, and who I am and what I bring to the practicum. So before I show you kind of my data, I want to talk about R graphs and kind of why they matter. So R is, for many of you bachelor students who took Health 425, is a statistical software where you can input a code and it kind of gives you a certain output. And you can create different graphs, plots, and different data visuals, even aside from graphs, which could be box plots and histograms. And during my practicum, I created actually 2 R graphs that will show the trend of substance use disorders and mood anxiety disorders, which are 2 chronic diseases in accordance with the BC CDC. And the trends and distributions of incidence and prevalence of chronic disease on the BCC are then studied according to BC health boundaries, age groups, and sex. So here are the graphs. So just a few things to highlight before I kind of get into what the data shows. So the incidence rate kind of in the title illustrates that the graphs measure a number of rate of people who have been newly diagnosed. So that would be either with mood anxiety disorders or substance use disorders. On the y-axis, we have the age standardized rates, which is calculated as if all health regions share the same age structure. And then on the x-axis, I presented data from years 2015 to 2022. So both graphs show BC males and females and Island Health males and females, and all data is actually from the BC CDC website. In figure one on the left, we see that there's kind of a relatively steady mood and anxiety incidence rate from 2015 to kind of 2018 for males and females of both regions, BC and Island Health. But then in both Island Health and BC females, we see kind of right before 2020 up until 2021, there is a steady increase and then actually a peak in the first point of interest that I circulated there. Why this is something that I kind of got asked during when I presented these graphs at an Island Health presentation, Lunch and Learn. Not really sure, but there could be speculation around post-pandemic effects. In figure two, we see there's 2 points of interest. BC males rapidly declining in substance use disorders after 2017, whereas Island Health males continue to steady increase after this period, eventually peaking in the second point of interest on the graph in about 2020, then rapidly declining over the year till 2021. There isn't too much of an intriguing trends in the second graph in females, other than a slow emerging increase in BC males and substance use disorder. So as public health advocates for efficacy through upstream health promotion and prevention, a foundation of public health preventive strategies is health surveillance. And this is kind of what encapsulates the data collection in the previous graphs. And disease prevention, health protection, and health promotions are reasons why we want to monitor chronic disease. So preventing chronic disease is not only cost effective, but essential to reducing a strain on the healthcare system. Since the 1990s, the British Columbia Chronic Disease Registries have been released each year to measure chronic disease burdens in BC, measure health inequalities, and support clinical and public health research. Key takeaways is standing by call to action number 22, which states we call upon those who can affect change within Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. As a graduate student of the Bachelor of Arts Public Health and Social Policy program, I plan to implement this call of action through advocacy and practicing trauma-informed care. As a current EA in my work experience, this is I've worked closely with Indigenous communities, and therefore I've been diligent in ensuring I'm working with and not against trauma-informed approaches and consistently reflecting on my positionality and how I can advocate for students within the educational system. One of the most meaningful aspects through my practicum, besides behind the scenes, were project reports, the development of new initiatives, and the multidimensional process anything must go through before being finalized. And this made me think of a concept that I learned through in Health 403, which is acting together. As a former BA student, I will continue to look for opportunities to apply my public health knowledge and enhance Indigenous voices through advocacy. And Island Health has definitely shown this through their initiatives and unwavering leadership and commitment to their work in public health. Thank you. And I'd just like to appreciate and send many thanks to my practicum supervisor, Jacqueline, all my fellow students, and yeah, all of you guys for listening.